my name's Alistair Morton. I work here as an oral surgeon as part of the maxillofacial team in the Salisbury District Hospital. We've been working together with 3D Replica, with 3D printing, particularly on surgical planning for some of our patients requiring complex treatments.
3D printing and the way it affects the medical world, it's improving patient care because the surgeon is able to pre-plan that operation to a higher degree. He's got a better understanding. All the staff going into that theatre have a better understanding of what's going to happen.
Sometimes conceptually and spatially it's difficult looking on a computer screen to establish the exact dimensions of the bone that's available to you for surgery. So one of the examples we've got is a young patient who had part of her lower jaw removed for cancer treatment and requested the teeth that were lost as part of the cancer treatment came to our department requesting that the missing teeth were replaced. Having the model printed allowed us to plan the jaw surgery, which in this case was a procedure called distraction osteogenesis, which involves making some cuts and then expanding the bone up in height, but using a vector which makes sure that the bone grows up in the right dimensions as opposed to in this orientation or in this orientation. And that allowed us to plan the surgery, but also then have the distraction plates constructed to give us a correct vector for growth. So this is one of the areas that having a 3D model has revolutionized our surgery.
When we first started investigating what type of printer to purchase, we wanted high-end medical grade 3D printers. We were hearing a lot that the Stratasys object printer was that type of machine. We did a lot of research with machines on a similar sort of par with the Stratasys object desktop range. We found that the Stratasys, the type of models it was producing, the high accuracy, the repeatability of prints, the way you could load the tray, the accuracy you get on fine detail within models was superior to any other machine we came across. So in the end we didn't just buy one Stratasys object desktop, we bought two.
3D technology and 3D printing has really revolutionized maxillofacial prosthetics and our technological area. We're able to adapt and use that in so many different specialties. It's allowed us to become less invasive with patients, so it may avoid us having to take physical impressions or get physically hands-on with a patient. We will cut the models so they can withstand the type of cuts. We will cut through them, varying either a saw or diamond discs. We'll cut through, we can remove, grind, without losing the integrity of the model or becoming too fragile. And from there, if surgical plates, titanium plates that are used at the time of surgery to hold those bits of bone in the correct place with the surgeon, we can adapt those. We can screw them onto the model if we wish. We can screw them on and hold them there, or we can purely just adapt on, but it won't affect the model in any way.